Interesting thing happens to women. Once they reach 40, the hormones start to go down, decrease, starting with testosterone, then 5 years later, progesterone, then 5 years later, estrogen, then all the hormones pretty much bottom out. In men, it starts around age 50. And then also you add to that low thyroid or sluggish thyroid function. So as we age, so many people get tired. They have brain fog. They have no energy, vigor. They start to gain belly fat. They start to get grumpy and irritable and depressed. And then they start developing disease. And they go to their doctor, their cholesterol goes up, they get on a statin drug, which lowers their testosterone even more. And then with all these symptoms, they're being treated with medications, when in reality, usually all they need is to optimize their hormone function with bioidentical hormones, or to use natural supplements to help balance their hormones when they're younger. And then that brings their hormone levels up to an optimized level to a 25-year-old person's hormones. For example, when I get the men's testosterone up to around 750, 800, all of a sudden, insulin resistance starts to go. Their body starts to lower, the blood sugar starts to be lowered. You add that to the keto zone, and you get a huge beneficial effect. Also, what happens, it protects the brain. Testosterone is especially protective to the brain. It also increases muscle mass. As we age, our muscles start to melt away because of suboptimal testosterone levels, and we start to develop what we call sarcopenia, frailty, or feebleness. You've seen people in their late 70s, 80s, 90s. They get real feeble, frail, and then they fracture a hip, and what happens? They end up in a nursing home. I tell patients the best nursing home insurance to keep you out of a nursing home is to get your testosterone level optimized to that of a young person.
Wow.
And we do that with either creams. We have some new creams that work amazing that you put behind your legs, and women say, does that mean I'm going to get a beard? No, you're not. Okay, or some people need a little higher. Now, we reverse osteoporosis with this, without the bisphosphonate meds. It starts to build muscle. It starts to build bone. It protects the brain. Women, it protects your breast. And it also helps so many disease processes. And then add that with the suboptimal thyroid. People say, well, how do you know my thyroid's suboptimal? I went to my doctor. He checked my TSH, and it's normal. He said my thyroid's normal, but I've got cold hands, cold feet. I take my temperature, and it's less than 98. That's your sign. If your temperature is less than 98, you got low thyroid, most likely. But cold hands, cold feet, that's your sign. You're tired. Not just tired. They say, I'm bone tired. And then your hair starts falling out, women especially, and then your hair gets wispy and thin. Then you lose your lateral part of your eyebrow, and then your skin dries out. You say, what's going on? My skin's dry. My elbows and knees are dry. My hands and feet are dry. And so all of these weird symptoms, you go to your doctor, and he said, oh, let's just give you a regular medicine to treat this and this symptom, this symptom. It doesn't work. But what we do is we check the test that needs to be checked. Your free T3. Your marriage. I tell women and men, do not get divorced until we balance and optimize your hormones, especially testosterone. And we can do it with creams, shots, pellets. It doesn't matter. I can do it now with creams, which is amazing. Also, I talk about estrogen. Estrogen was vilified in 2002 in the Women's Health Initiative, and from that point on, the majority of doctors quit prescribing estrogen. And from that point, one study found that over 91,000 women died prematurely from osteoporotic fractures and other things over a 10-year period when those hormones would decede by most doctors. But again, I talk about the problems with the study, how you shouldn't be concerned, what to look for, because some estrogen is okay provided you don't have breast cancer. I also talk about progesterone. Progesterone is one of the most amazing hormones for women, but not synthetic. It has to be the natural, bioidentical, micronized progesterone. Thyroid hormone. Thyroid is so important. So many people, as many as 40% of the population, have suboptimal or low thyroid. Again, a lot of people have a normal thyroid test, TSH, but when you dig a little deeper, run some other tests, do a reverse T3, do a free T3, do thyroid autoantibodies to make sure they don't have Hashimoto's thyroiditis, which is
where are they, you're saying
thyroiditis.
do all these, but where in the world is the average person going to do all that?
I describe it in the book, where to go. What to ask your doctor for. You can ask him for these tests, and he
Will
can do it.
doctors cooperate? Do they think you're just some kind of a nutrition guy that doesn't understand the importance of all the pharmaceutical drugs to put everybody on?
Yes, now that is the case in some, yes. But I put different organizations of doctors that are open-minded that actually endorse what I do.